Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic.
The disease has already claimed more victims than Legionnaire's disease and toxic shock syndrome combined. At first, it seemed to strike only one segment of the population.
Now a health threat to the general population.
It's called AIDS, AIDS.
New cases of HIV in LA County are on the rise.
Tens of millions are expected to die of AIDS.
Close to 40 million people in the world live with HIV.
Back then, a diagnosis was also a death sentence.
Negative attitudes about HIV are literally killing people.
There is no cure.
Proposition 64 was a proposition in the state of California on the November 4th ballot in 1986. Activists associated with Lyndon LaRouche formed the Prevent AIDS Now Initiative Committee, also known as PANIC, to place what became Proposition 64 on the California state ballot.
California won't panic, no on 64. California won't panic, no on 64. California won't panic, no on 64.
In 1986, there was an initiative on the ballot in California to quarantine people who were HIV positive by a right-wing fanatic called Lyndon LaRouche.
Proposition 64 essentially would include AIDS on a list of diseases which can be regulated by the state based on the fact that they are communicable. And in that manner, it would give county health officers the power to prevent people who have AIDS or who carry the AIDS virus in their systems from working in schools or as food handlers, and would give them the ultimate power to quarantine those people if they felt they posed a health risk to the general public.
No more Manzanars, no on 64! No more Manzanars, no on 64!
We planned a torchlight march on the headquarters of Lyndon LaRouche, which was in Atwater Village.
No on 64! No on 64! No!
We got people like Patty Duke, who's the head of the Actors Union, and some different political figures to back us.
It scares me, and I am frightened.
At that time, we thought that the odds were that it was going to pass, which was horrifying. But how it turned out was that it lost overwhelmingly.
We assembled here tonight will be the voice of conscience saying to Lyndon LaRouche, go elsewhere. This is not where you will have your victory.
So when the campaign was over, we said, well, we've stopped something bad from happening, but what do people actually need? And literally, people were dying in the hallways of the county hospital. And so we said, you know, the least we can do is give people a dignified death.
It is a week ago today that the government finally gave its permission for the drug AZT to be sold to people who were suffering from AIDS. It is not a cure, as you know, but AZT does prolong life for AIDS victims.
We were always an advocacy organization. And so one of the things we did at the beginning was we formed this blue ribbon panel, this commission on hospice care. And we held an all-day long thing, and we had people come and testify what the needs were.
How many of you have been to 5P21, the AIDS unit in USC? Because if you had gone there, you would see exactly what the medical treatment is being like. They're overcrowded, they're understaffed, the rate of burnout is incredible. You see patients who are weighing 90 pounds sitting on a wooden bench for 3 to 4 hours. This is not humane to me, to see people suffer. We have a hospice program that is working in San Francisco. We have a hospice program in New York that is working. There is no reason why we can't look at their programs and start one here in LA. Because I'll tell you, anyone with AIDS would rather die at home than die at USC.
But then we started campaigning about the neglect that LA County was visiting upon the community. And so we wound up having a candlelight march to the home of the then chair of the Board of Supervisors, Mike Antonovich, who had said that the way to deal with AIDS was for gays to turn straight.
Why is this occurring? I think the reason is very simple. It's basically homophobic bigotry, and the government does not care. Health and Human Services, Margaret Heckler says, we have to stop AIDS before it spreads to the heterosexual community. In other words, who cares about gay people?
We got then Supervisor Ed Edelman to put forward a motion to give $400,000 to us for the Chris Brownlee Hospice. Then a conservative Republican on the Board of Supervisors named Pete Shabara, he gets up and he says, well, I don't understand why all this money should go to Edelman's district, you know. So Edelman thought very fast and he said, I agree with you. I think we should have $400,000 for each of the 5 districts. This is the first time in the history of Los Angeles that people went in asking for $400,000 and walked out with $2 million.
In response to a dire need, the AIDS Hospice Foundation was formed. In 1988, AHF opened a 25-bed hospice near Dodger Stadium, the Chris Brownlee Hospice.
The reason why we named it after Chris Brownlee was, you know, he was a hero. He was, you know, a fighter. And, but I think that we felt that, you know, in terms of creating an institution, it was important that people within the community, within the battle, be honored in that way.
As human beings, I think one of the things that differentiates us from other animals is that we take care of our own. And in this environment, in the AIDS environment, taking care of our own sometimes means providing people with a clean, warm place to live out the last days of their life, and a way to die without the distractions of homelessness or freaked out relatives or any of those things.
The significance of Chris Brownlee Hospice and later the other hospices, but particularly Chris Brownlee in the beginning, was that there was no other place for these people to go and be treated like human beings because there was so much stigma.
I'm a paramedic for this city. I go in, when I go up to a call, I can maybe have to walk 15 floors up to a project building where there are people that are shot, splattered with blood all over, and you're saying precautions? We do wear the gloves, but the gloves ripped, there's glass all over. How are we supposed to protect ourselves?
We are in a situation here where there's incredible ignorance, incredible fear, and incredible discrimination.
It is hard not to discriminate against something that is life-threatening, that is so easily contractable.
It was really scary and crazy. If you were gay, a lot of people automatically thought you had AIDS, so they treated you with that stigma.
We're going to be discussing homosexuality.
Barney's Beanery has had a sign that says, faggots stay out.
A young man, a college student, Matt Shepard, was murdered, and they put him up as a scarecrow, and they left him there for 18 hours. Some feel it's a hate crime.
We are having to go to a system where we'll probably have to breathe from outside the operating room because when we drill and ream on bone, we are most likely aerosolizing blood products and the virus, which can go into our lungs.
I had so many moving and emotionally touching memories of being with patients, especially when they're dying. The patient that I was closest to, her name was Terry, too, Terry with a Y. She was Native American, and we were really close. And I was on the other side of town, and I got a call that Terry was going to be not around much longer, and I had to get back. So I got in my car, and I remember driving, hoping she would still be there when I got there. I don't think I could talk about this one. And I got there, and I rushed into her room, and she was there. So I got on the bed with her, and it's really the only person that's ever died in my arms. And I could feel her going. She died, you know, I told her to go. It was okay to go. And then I literally felt her leave her body. And I'll never forget that day.
This is probably the most loving place I've ever been. It's a home in every respect that you can imagine. You have all the love that you need. People miss you when you go shopping or whatever. They cry for you when you die. They worry about you when you're sick.
I mean, we're just like a family. We fight, we argue, we laugh, we cry together. We support each other. We, help each other out. This is what we have. This is a family.
I tell people all the time, if you come walk with me through the hallways and into the rooms and meet our residents, you will understand, not only with your mind, but with your heart.
I would be dead by now if it weren't for Chris Brownlee. I really would. I would have had to go back into my car to sleep, and I would have probably died.
AHF later opened Carl Bean House in underserved South LA, and another in Los Angeles called Lynn House.
To give us our formal welcome address, Reverend Carl Bean.
It's a great day for all of us in that this is a day that will celebrate the lifting of oppression in this community. But most of all, don't just come today for the ceremony, but when the doors are open and patients are within, come, roll up your sleeves, visit, touch, hold, and heal, for that's the purpose of it all. God bless you and welcome again.
Thank you, Reverend Bean.
We're going to have a little ceremony to plant a tree in the name of one of the founders of the AIDS Hospice Foundation and the man for whom the first hospice that we currently operate is named Chris Brownlee, without whom almost any of the residential care being provided in LA County may not have happened.
In 1989, however, Chris Brownlee, a passionate activist who was a guiding force in LA's AIDS movement, died tragically from AIDS. He was 39. Brownlee's death was a devastating loss, but his dedication to fight for the living and care for the dying would always inform AHF's work.
In hope for everyone that will spend their time within these four walls, in thanks to everyone who has made this building possible, in particular tribute to the men and women who will sit up many, many late nights, providing hope and inspiration and a way of a dignified exit from this earth to the fine people who are within. I cut this ribbon. One day it will be the last one.
Once we had established the hospices and we had given people a place to live out their last days, we began to see that treatments for opportunistic infections were improving, and so the life expectancy was expanding. So we realized that what people really needed was medical treatment in an outpatient setting. So we began opening up clinics. So we said we can't operate clinics for the living with a name like the AIDS Hospice Foundation, so we changed it to the AIDS Healthcare Foundation.
The clinics came about not just as a response to overcrowding in the public health system for HIV, but really in a change of the agency's mission. I mean, we didn't want to be remembered only for being there in the last days of a person's life. We wanted to be there every step of the way.
To better serve people living with HIV/AIDS, AHF launched the Positive Healthcare Program.
Positive healthcare was an idea to take people that have HIV and AIDS and put them into a health plan that could really address caring for people with HIV and AIDS, and so they would not get lost inside of a regular health maintenance organization, an HMO. Michael Weinstein's vision was that he did not want to see people with HIV get put into systems that did not know how to take care of them.
At County, I kind of felt like I was just a number, and I feel that the clinic really centers towards women and minority, and I feel that that's something that a lot of people in other clinics in other areas don't acknowledge.
As we started getting more women, it was felt by AIDS Healthcare Foundation that we needed to look at the special needs of women.
It was important. It was groundbreaking. It was the only one in the nation And it was so that people could feel safe, that they could know that people who were taking care of them knew what they were doing and cared enough about them to make sure that they could succeed in obtaining as much wellness as they possibly could with HIV disease.
Out of the Closet, which is the largest AIDS-related retail business in the country, it celebrated its 10th anniversary today at the flagship store in Atwater Village.
To further fund their mission, AHF also entered into a social enterprise model, opening a chain of out-of-the-closet thrift stores as well as a line of their own pharmacies. Social enterprise is when a nonprofit creates a business to generate revenue for its own operations.
So AHF has a unique revenue-generating model. It's a social enterprise within itself. We use our pharmacies and our other business lines to generate revenue to help run the programs that we run throughout the world. So by generating our money as a social enterprise and allowing us the freedom to make appropriate decisions that are in the best interest of our patients, we can be strong advocates and we can stand up for people everywhere who are impacted by HIV.
Scientists in the United States are claiming dramatic success for a new drug treatment for AIDS. 8 patients were given a course of 3 drugs in combination, and researchers found the virus was almost undetectable 2 months later.
In 1996, a new class of drug treatments was approved to treat people with HIV/AIDS. It was a combination of drugs, or cocktail, that was a major improvement over previous drug treatments.
A year ago, Sean Strube was almost dead from AIDS. His body was covered with AIDS-related skin cancer. Now, taking a new combination of drugs, including a new class called protease inhibitors, he has gained 20 pounds, gone back to work, and the cancer is gone.
In 1995-96, we were operating 3 25-bed hospices: Chris Brownlee Hospice, Carl Bean House, and Lynn House. At the same time, in our healthcare centers and our research division, we were testing the cocktail, this new revolutionary breakthrough. And Dr. Charles Farthing, who was our chief of medicine at the time, was on the cutting edge of that.
I've really had about as close to a miraculous recovery, certainly more so than I ever imagined I would see.
When the drug became available and the miracle that it produced was clear, we made a decision to provide it to patients who were close to death to see if we could save them. So we started with providing the drugs to patients in our hospices, and we had no other choice but to pay for them because the government program hadn't been set up yet.
1996 was a watershed year in AIDS. It was the first year, the first time that treatment actually outpaced the virus.
The government didn't start paying for the drugs for people who couldn't afford them until July of that year. So we were supplying these drugs without getting reimbursement for them, not only in the house, but in the clinic as well. So we came really close to bankruptcy.
Not everyone at AHF agreed with Weinstein. Within some circles, people believed he was reckless and needlessly courting financial disaster. An attempted coup sprang up to oust Weinstein and take away the organization he had co-founded.
Our chief financial officer at the time was speaking to the board about the impending doom, and it created quite a lot of strife at the board level. And it got to the point where there was a possibility that Michael could be actually removed as the chief executive as a result to all that stress and strain.
But I wouldn't have done anything different because it was really a moral imperative. I mean, you couldn't let people die who you knew could be saved.
Shifting to a giver of life, AHF would feel a profound responsibility to provide free HIV drug treatment to anyone who needed it, no matter where they lived.
What happened was virtually all of the patients got better within a month or 2. And whereas before that, hardly anybody left the houses. And most people, they came there and that's where they died. But all of a sudden, people were leaving and going back to their lives. And that was just miraculous.
By 1999, AHF had 6 outpatient clinics in Los Angeles County, 15 out-of-the-closet thrift stores, and a growing national reputation as an effective and forceful advocate for people living with HIV and AIDS.
Once we came out of this financial crisis that we had when we were starting to treat patients in '96, we said to ourselves, you know, we need to bring as many people into the lifeboat of care as we possibly can. And that's not based on one city. So we began to expand. And the big breakthrough for us was when we got a contract with the state of Florida to provide care in all 67 counties.
Magic in the Magic City. Magic Johnson, that is. The legendary athlete is launching a free HIV clinic in North Miami Beach as the local basketball star cheers him on. He's partnered with the AIDS for Healthcare Foundation to open 4 other Magic Johnson clinics throughout the country.
And then, you know, you go to places like Jackson, Mississippi, where the stigma is so intense and the need is so great. But that's the ethos of AHF, is to go where the need is the greatest.
A cross-country HIV testing tour kicked off in the West Adams district today. The nonprofit AIDS Healthcare Foundation launched a 3-week, 14-city campaign to increase the number of Americans tested. Mobile HIV testing vans will be driven to cities across the country where they will set up shop in parking lots at malls, nightclubs, and other popular places. The tour will end in Washington, D.C. in time for National HIV Testing Day on June 27th.
When we started in LA, we went to South LA and we went to Echo Park, we went to all these places. We didn't expect people to come to us, we went to them. So now we are in many of the southern states where the need is the greatest. We're in most of the epicenter cities in this country.
For AHF's next mission, it would find itself in an international showdown with an entire government.
$14 million have died already. 23 million more are infected and will almost certainly die. More than 10 million children have lost parents. This is the harsh reality of AIDS in Africa.
In 2000, planning to attend the 13th International AIDS Conference, Michael Weinstein traveled to Durban, South Africa, where people were dying by the thousands from AIDS.
When I attended the International AIDS Conference, they had a opening ceremony in a big cricket stadium. And the ceremony was an extravaganza. It was more like Cirque du Soleil than the opening ceremony of an AIDS conference. And there was a lot of buzz about what the president was going to say, president of South Africa, and Becky. So we were in the stadium and he came out to speak. And he said that AIDS was caused by poverty.
As I listened and heard the whole story told about our own country, it seemed to me that we could not blame everything on a single virus. The world's biggest killer and the greatest cause of ill health and suffering across the globe, it is extreme poverty.
And he was sending a clear message that HIV didn't cause AIDS. He was doubling down on that. And so a bunch of us got up and walked out. I went back to my room and the porter said, there are people looking for you. I said, oh, okay. And I went to my room and I noticed that somebody had slipped a note under my door. And they said, you know, we're local activists. We're sitting downstairs in the restaurant. We're going to wait for you. So I went to see them and we talked. And I said, well, you know, going to a conference like this and having all these academic papers presented is fine, but I'd like to really see what's happening in the community. So I said, you know, can you take me out and show me? So the next day we rented a van and we went out and we visited a lot of different sites, and it was just heart-wrenching. In all that I had seen with people dying of AIDS, when I went to the hospital wards there and saw young women so filled with hopelessness, it was just a terrible thing.
Before we left, I remember Michael saying, I'm not so sure that, you know, even if we're confronted with, you know, how horrible the situation is, whether there's much we can do, but we're going to go anyway and we'll see. And you know, at the time, the president of South Africa, Thabo Mbeki, was, you know, the world's biggest AIDS denialist. And, you know, his administration was putting out information that the new drugs in the developed world were poison. And so a group of us went to South Africa, and I knew that it was going to change the organization forever.
Teaming up with local AIDS activists who are also willing to defy the South African government, AHF opened its first clinic, Item Balabantu, in Umlazi, South Africa.
I'd like to welcome all of you today. Today we're celebrating our first year anniversary since we opened the clinic, and we're very excited about this opportunity. When we went to California, what we saw was a totally different approach by an NGO where they had a healthcare facility treating people and at the same time advocating against their government to do more for the people in the ground. We've got very committed volunteers who do not get tired even if they don't get paid, they don't have any bus fare, but they still come every day to support the clinic facility. So thanks to everyone.
People around here, my neighbors, that's Diane. A year ago, she fetched me from the hospital. And I think the day I left the hospital, the doctor sent me home to die. Today, I have a minus 50 CD4 count, viral load, and 3 months ago, my CD4 was 165. I can get up in the morning and see to my kids. I can prepare their breakfast. I can supervise homework. I can work. And most of all, I can be around at least that my children see adulthood before I leave them.
Shortly after the success of Item Balabantu Clinic near Durban, AHF went on to open another clinic in Uganda.
By the time AHF came to Uganda in 2002, the situation was already very dire. People had been dying left, right, and center, and AHF was the first organization to offer ARVs in public health settings, working with government to offer much-needed medication.
When it was clear that the benefits of treatment would work in Africa, we started pushing our own government to do more.
AIDS can be prevented. Antiretroviral drugs can extend life for many years.
President Bush was in the White House, and in the State of the Union address at one point, he made it a centerpiece aim of his, to develop what came to be known as PEPFAR.
And to meet a severe and urgent crisis abroad, tonight I propose the emergency plan for AIDS relief.
A few years later, thousands of Ugandans marched with AHF on World AIDS Day.
Today in Uganda, there are still more people dying of AIDS than living with ARVs. So we will turn that tide, I hope, very soon. But every day counts in that battle. Because our goal is not only to save lives, but our goal is to end the scourge of AIDS in Uganda, in Africa, and the world.
One night it was late, and I was driving with one of our staff people in Uganda, and as we pulled up to the airport, the security approached the car, and they, made us stop, and they checked the car, and security came around to my side of the car, and they motioned for me to roll down my window. And so I did, and the guy leaned into the car and said, "Are you with AIDS Healthcare Foundation? Are you with Uganda Cares?" And I said, "Yes." And he said, "Thank you for saving my brother."
You have my promise today that AIDS Healthcare Foundation will be here to help for as long as we are needed.
So where we are now, as the largest AIDS organization in the world, advocacy is still very important, but what we've decided to do is ratchet up to much higher levels. Like in countries around the world, we want to meet with the members of parliament. We want to meet with the prime minister. We want to meet with the health secretary, because those are the ways to actually change policy.
The experience of being a physician in an HF medical center, I truly believe that that's a place that has been a blessed place for me. It also happens to be a place where there are a lot of surprises because many people who have been highly stigmatized, discriminated, and looked down under. So people are like thrown out of your workplaces, you're thrown out of your houses, you don't have any entitlements, you don't have any rights, no status in the family, no status in the society. This is actually a bunch of people who are nowhere, left to be only with them and the like. So they need a lot of empathy, and that's actually the factor that actually prompted me to be there. One day in my clinic, I find 3 people coming in with a gunny bag. And suddenly they lift up this gunny bag and then put it on my table. And they opened up the gunny bag and I found a person who was like rolled up. And he was all dark, completely filled with skin infections. His body is like full of blisters. He had, oral ulcers. His mouth was like open and gaping. He couldn't even open his eyes. And these guys say, we're not going to touch him. So I called the nursing people, I called my staff, and I said, come and help me with this. So we examined, we found that he had multiple infections because he's full-blown AIDS. A normal man should have ideally around 1,000 CD4, but here is a man who's put on my table in a gunny bag with a CD4 number 2. Around 5 months back, I find a man in a security officer's dress. He came back and he said, how are you, doctor? What is happening? I have not seen you for the last 4 months, 5 months and all. I said, yeah, but then I don't remember you, which agency are you working for? So you don't remember me? I said, no, I don't remember you. Then he said, do you remember a person who was brought in a gunny bag? I said, yeah, of course, nobody can forget that. And he said, I'm that person. I said, what? In 4 months' time, this man, he regained his color, the skin color, all the infections were cured, his mouth ulcers are over, his TB is fine, his ART is regular, his CD4 is improved, and I could see a man fully active. So I expect all our clients to be like that.
Corporate headlines as there's a row over the cost of HIV and AIDS drugs, with Europe's biggest pharmaceutical company, GlaxoSmithKline, under fire. The US AIDS Healthcare Foundation has banned Glaxo sales representatives from its clinics. It accuses the company of charging twice as much for its drugs in the developing world as other drug makers do. Glaxo's combination therapy products cost almost $2,000 per patient per year. The foundation is calling for the UK firm to slash the cost to some $500 instead.
When a pharmaceutical company develops a new drug, that drug is covered under patent protection. This means that the only company that can manufacture, market, and profit from it is the holder of the patent. Patents last for 20 years.
¿Puedo verte la garganta? Muéstrame a ver. Abre bien la boca. Oh, ok. Bien. Tranquilo. Bueno, puede ser que esto sea una candidiasis esofágica, que tenga un problema para tragar. Sí. Si él no puede tragar, no se alimenta bien y eso lo desnutre un poco más. Sí. El medicamento que él necesita se llama fluconazol. Una capsulita todos los días, nada más.
Well, the drug pricing battle is so important because it's one of the greatest injustices that exists in the world, that billions and billions of people don't have access to life-saving and life-improving medications.
That's 443 lempiras, which is about $27. Yes. And that's just for the one single tablet. And how much does your husband earn in a week?
My husband earns around $90 a week.
At $27 a tablet, a week's worth of medication for Hyro is $189. That's more than double the entire income for the family.
The logic of pharma as a profit-making enterprise is to find the price point that maximizes their profits. In doing so, that's going to make the prices of drugs out of reach for a lot of people, which is going to harm them, which is going to exacerbate the epidemic.
Back in those early days, whether you were part of a pharmaceutical company or you were a treater, there certainly was the profit motive, but there was a lot more compassion and empathy. Well, that certainly isn't the case anymore now. It's just too much about what's the maximum we can squeeze out, with these medications, and that's a sad thing to see.
Porque lleva 5 días sin comer ya. Jairo necesita una oportunidad, pero esa oportunidad debemos de proporcionársela a todos nosotros.
You cannot rely on a for-profit business model to provide care to people with infectious diseases. It just doesn't work.
People are struggling all over the world to pay for their medications, and even hesitating to see a doctor or go to a hospital. Like Jairo, many people die simply due to the fact that they can't afford their drugs. If these drugs were more affordable and available, many lives would not be lost.
Drug prices are not too high. They're obscene.
Got that right.
Okay. The cost of the latest AIDS combination therapy is $28,500. That's more than the average person living with HIV earns in a year.
Why do prescription drugs cost so much money?
On average, it costs $800 million just to be able to get one new medicine to market.
Prove it to me.
These are business proprietary pieces of information, often which will involve trade secrets that the companies understandably will not want to have disclosed publicly.
Every single day, people are choosing between medications and food.
The issue today is whether the Congress has the guts to stand up for their constituents, people who are being ripped off.
This is the ultimate David and Goliath story.
Do we want to entrust critical elements of the public health to an industry whose purpose, whose mission is to earn return for shareholders?
The pharmaceutical industry wins every single time.
A march involving AIDS and AIDS treatment is set to take place next week in Spain. Organizers expect over 10,000 people to participate in the March for Life in Barcelona on the 7th of July.
No more stalling. The world is calling. AIDS treatment now.
There are many parts of our globe where infections are rising to epidemic levels.
Medication for every nation. AIDS treatment now.
The price of drugs is still too high.
Let us demand that the world's wealthiest countries put their resources into fighting this pandemic.
If we don't act, we will pass the point of no return. Stop the crying. Stop the dying. AIDS treatment now. I speak on behalf of the 34 million people in the world who are living with HIV and in the memory of all those who have died. You will not be forgotten.
Aggressive and unafraid, AHF sued several pharmaceutical companies, including giant GlaxoSmithKline, to force them to lower their HIV drug prices.
We demanded GSK to take the prices down, and we went to demand that with our placards.
In 2003, under intense pressure from AHF, GlaxoSmithKline slashed their prices for developing nations.
The majority of people in the world didn't know they were positive just a few years ago. And we said the only way you're going to change that is to make testing much more convenient.
By the mid-2000s, AHF was also building up a global program known as Test and Treat. The idea was simple. Test as many people as possible to find those who are HIV positive and quickly get them into treatment. It would not only save lives, but people who properly took their medications would not spread HIV to others. No other AIDS organization was executing such a program on such a global scale.
This started with us in 1998. in California when we realized that you couldn't get an HIV test unless you went to a clinic from 9 to 5, Monday through Friday. And we just thought, that is ridiculous. You know, we need to shake this up. So we had out of the closet thrift stores at that time, and we said, let's put the testing in the thrift stores. And nobody had ever done anything like that. And we also created a coffee house that you could get tested right in the middle of West Hollywood till midnight every night. So that radically changed testing for us. But at that time, the test took 2 weeks. So even if you got the courage to get a test at 11 o'clock at night at the WeHo Lounge in West Hollywood, you had to wait 2 weeks. That 2 weeks was agonizing for people, and many did not come back. Jump forward to the present time, where we have 1-minute rapid tests. It's a finger prick. You don't even have to wait 5 minutes, and you can find out your HIV status. So that eliminates losing all those people that, you know, we're not going to come back to get it. You get 100% diagnosis, you know, and disclosure to the people that are there that are trying to find out their status. And it has just radicalized everything.
I think it's very important to have mass testing initiatives in collaboration with an institution like AIDS Healthcare Foundation.
These hundreds of little tweaks to the system that we learned through experience, through hard-won experience, are incredibly valuable. But the sum total of it is that a person can find out they're positive today, be in the clinic tomorrow, be on treatment shortly thereafter, and be restored to wellness within a very brief period of time. And you cannot overstate the importance of compassion. There's a big technical aspect to running a healthcare system, but there's a big aspect of cheerleading and encouragement and empowerment. The human touch is still the essence of what we do. That encouragement that we give to people to get tested, to get treated, to adhere to their medications, to show up for their appointments, that is still, you know, the lifeblood of the organization.
After successfully implementing the test and treat model around the world, AHF focused their efforts on prevention. They would manufacture and distribute free condoms and encourage safer sex. AHF also established a cutting-edge in-house marketing department known as AHF Worldwide, seeking to influence society through changing culture. Utilizing innovative techniques, the division constantly rolls out safer sex messages, advocacy campaigns, and HIV testing and treatment messages around the world.
The marketing effort at AHF is partially about getting people to come to AHF for our services, whether it's testing or whether it's coming to a clinic or a pharmacy and the like. But it also plays a very important role in terms of awareness. AIDS is no longer on the front pages of the newspapers, and a lot of people think it's not an issue any longer. So being able to run marketing campaigns, whether they're billboards or commercials or online, it's really amplified who we are as an organization. And a lot of it's controversial, and that's intentional. We want people to pay attention.
Dating apps are coming under fire on a new billboard. The billboard is accusing them of promoting hookup culture and helping spread STDs.
We put up a billboard in Uganda that we had run here. It said, cheating, use a condom. Cheated on, get tested. And it sparked a big controversy. And some friend of mine had read about it. And he said, well, you know, you ran this national campaign in Uganda. I said, no, actually, there were only 4 of them. But it got magnified. And then when the Pokemon craze was going on, we did that. And when Straight Outta Compton was the rage, we had Straight Outta Condoms. And it has made us famous. But you know, that's not a goal in itself, but it really helps to get people in. The whole global project of AHF, this whole incredible adventure started in Durban. And I've been back to Durban many times since then. But this was only the second time that the conference was on the African continent. It was coming back to the same place where it had started in 2000. And we had made the decision that we were going to have a massive presence at the conference, including a march and a concert.
The march in Durban in 2016 was the culmination of many years of AHF organizing marches. We needed that march to be big.
Honestly, I was shocked by the turnout, and I couldn't believe how many people were there. We had Queen Latifah, we had Common, and we just filled up the street with a sea of green T-shirts. It was really a wondrous thing to behold.
To see the mayor of Durban there, the community activists and gatekeepers, but it's really the clients that inspire me. Again, you can't but help feel really good about the work that AHF has been engaged in for 30 years and the significant impact that we've had on a global level in terms of saving lives, impacting public policy, and trying to stem the tide of HIV disease on a global level. So I feel really proud to have been a part of that process for the last 29 years.
In my heart, I was just amazed. It was such a beautiful thing that so many people came out 15 years later after we started there to march, to raise the flag, on HIV/AIDS, that it's still a crisis. It was one of the best moments of my life.
We made history in South Africa, and that day was the celebration of that.
There's still so much to do for all of us at AHF and around the world that work in this field. For us specifically, one of the goals is to get 1 million people under AHF's care. And we're getting close to that. We're getting close to 800,000, so that's coming. We're going to be in 50 countries before you know it. And we really have to keep the advocacy up for test and treat. One of our strongest campaigns is 20 by 20, and that's to make sure that 20 million people are on treatment by 2020. And we hope that it's many more than 20 million. It should be much more than 20 million, but we're not there yet.
I think our future is one where we are going to continue doing what we've always done as a treater and as an advocate. We're going to continue to build programs. We're going to continue to add sites in different parts of the world where the need exists. We're going to continue to push donor countries to put adequate resources on the table to deliver this care.
In addition to that, we have to fix the public health system. If we ran air traffic control the way we run global public health, planes would be colliding in the sky every single day. It's chaotic. If we want to have a really integrated system of care on an international basis, not only for treating HIV, but for conquering TB and malaria and other infectious agents that are going to come along, including sexually transmitted diseases, we have to have an integrated system, and that needs to be based upon a global treaty, global convention on public health. And so that would be my biggest ultimate goal.
It's important for AHF to continue fighting for what's right, because there is no sense of urgency that we see, around the world. It's a critical time. We're in a fork in the road. There is a goal and a plan to stop AIDS by 2030, and we think that that's actually possible, but with a lot of shakeup and a lot of fighting to restore a sense of urgency and maintain it. So we feel we have a very strong role, and it's mainly to remind people that AIDS is not over and that we're still in a crisis.
What I would say to the people who work for AHF or are part of the AHF community is that I'm incredibly proud of you. I think that there's very few places in the world where you can be a part of history, where you can genuinely say that you've saved lives, that you've changed lives. And I hope that people who work for AHF and who are part of the AHF community, that they take as much pride and that they understand what an important contributor they are to the big success that we've had.